Hi, Eileen Bayer, the fam here. Welcome to the last episode on Huntington's disease, where we're going to discuss treatment, lifestyle changes, and all the things that can help with this disease. So, saying that, let's get started. No treatments can alter the course of Huntington's disease, but medications can lessen some symptoms of movement and psychiatric disorders. And multiple interventions can help a person adapt to changes in his or her abilities for a certain amount of time. That is why medication management is likely to evolve over the course of the disease, depending on the overall treatment goals. Also, drugs to treat some symptoms may have side effects that worsen other symptoms. Therefore, the treatment goals and plan will be regularly reviewed and uploaded. So some of the medications, they have medications for movement disorders that do have side effects that will worsen other ones, like they were saying, like tetrabenzine. That worsens the depression that people get with Huntington's disease. Antipsychotic drugs will cause muscle rigidity, but they have, it. They do antipsychotic drugs, medications for movement disorders, antidepressants, antipsychotic drugs, mood stabilizing drugs. Those are all the types of medications that's used to treat people with Huntington's disorder. They also offer psychotherapy, which is a psychiatrist or a psychologist or clinical social worker that provides talk therapy to help a person manage behavioral problems, develop coping strategies, managing expectations during progression of the disease, and facilitate effective communication among family members. They also work with their speech, with speech therapy. Huntington's disease can significantly impair control of muscles of the mouth and throat that are essential to speech, eating, and swallowing. A speech therapist can help improve the ability to speak clearly or teach you to use communication devices, such as a board covered with pictures of everyday items and activities. Speech therapists can also address difficulties with muscles used in eating and swallowing. They use physical therapy. The physical therapist can teach you to appropriate and safe exercises that enhance strength, flexibility, balance, and coordination. These exercises can help maintain mobility as long as possible. It may reduce the risk of falls. Instruction on appropriate posture and the use of supports to improve posture may help lessen the severity of some movement problems. When the use of a walker or wheelchair is required, the physical therapist can provide instruction on appropriate use of the device and posture. Also, exercise regimens can be adapted to suit the level of mobility. They also use occupational therapy, which they help family members and caregivers with the use of assistive devices to help improve functional abilities for their patients, such as handrails, assistive devices for activities such as bathing and dressing, eating and drinking utensils adapted for people with limited fine motor skills. Also, now we're going to also cover the lifestyles and home remedies that some people do, Managing Huntington's disease is demanding on the person with the disorder. Family members and other in-home caregivers. Assisted disease progresses, the person will become more dependent on caregivers. A number of issues will need to be addressed, and strategies to cope them will evolve. For instance, eating and nutrition. People with Huntington's disease often have difficulty maintaining a healthy body weight. Difficulty eating higher calorie diets is needed because they can't be as active. So their calorie intake has to be much higher than ours. Chewing and swallowing means their food's going to have to be ground up, or another purpose. The family's going to have to help manage congenital and psychiatric disorders by using calendars and schedules to help keep a regular routine, initiating tasks with reminders or assistance, prioritizing or organizing work or activities, breaking down tasks into manageable steps, creating an environment that is calm, simple, and structured as possible, identifying and avoiding stressors that can trigger outbursts, irritability, depression, or other problems. For school-age children or adolescents, these are for people that have Huntington's at a young age. Consulting with school staff to develop appropriate individual education plan, and providing opportunities for the person to maintain social interactions and friendships as much as possible. As far as the coping and support, there are a number of strategies that may help people with Huntington's disease and their families cope with the challenges of the disease. There's things like support services. Lots of nonprofit agencies help with this. You have local and state health social services to help with it. And they also have to think of the planning for residential and end-of-life care, because there is no cure for this, as you know. So the patient that has Huntington's, it's not like any other mental disorder. It will kill you. So they have to think about the residential and end-of-life care. And because of the progressiveness of the loss of function and death, it is important to anticipate care that will be needed in the advanced stages of the disease and near the end of life. Early decisions about this type of care can enable the person with Huntington's disease to be engaged in these decisions and to communicate his or her preference for care. Creating legal documents that define end-of-life care can be beneficial to everyone. They empower the person with the disease, and they may help family members avoid conflict late in the disease progression. Your doctor can offer advice on the benefits and drawbacks of care options at the time, when all choices can be carefully considered. And such things that need to be included in that are care facilities, hospice care, living wills, if there is any, in any advance directive. All that is important. So all that needs to be considered and discussed with your care team and your loved ones if you have it. And if you know somebody in your family that has it, all this should be done in the beginning stages of Huntington's disease. This way, the person that has Huntington's disease can take part in the decisions, because after all, it does evolve around him. It's his care, his needs that need to be met. So if everybody can work together in the beginning of this disease, it makes it a lot easier when the progression gets to a point where they can't do it. And that's the last of this series. I will be putting a poll up again for the next choices for the next series. I hope you learned a lot in this series. And don't forget that if you like this content and you are new to my channel, please feel free to subscribe and ring my bell so you don't miss any of my upcoming videos. But before I leave, let me let you go with the saying that I always say, to remember to see with your heart and not your eyes, because what the eyes see is not important. What is important is invisible to the naked eye, which is your heart. The heart is what matters, because this is just a shell, and it can give a false indication of that person or anything else. So learn to see from the heart and not with the eyes. And remember, you matter to me. You're important, and I love you for you. So until we see each other again, love you. Bye.